Hello everyone and welcome back to my channel. So today we have another health topic that I want us to discuss with you guys. Okay, it's one of those quite common things that happen as well. Once again, I'm not a health practitioner. It's just through experience and research that I've done. If you have any issues with any health related issues, please go and see your doctor, or go to A&E as soon as possible. But any questions to do with any health benefits or any other thing, please feel free to ask, and I can give you as much information as I can. If not, I can direct you where to go. Okay, so today we're going to be talking about what do we know, how do we know when it's a heart attack? If you're having a heart attack, God forbid, how would you know if that's what it is? Okay, so I'm going to just give you some things to look out for if that's what you have in, and then hopefully that will help you to detect on time what to do and how to seek help. Okay, or even if it's somebody else going through that, how to help that person. Okay, so how do you know when it's a heart attack? So sometimes people dramatically kind of clutch very tightly to the chest and also slowly sink into the floor. It's often how heart attack, seem to be portrayed, like in the movies and things like that. So heart attack symptoms can arise suddenly. Okay, and it can be intense, and more often the symptoms start more slowly and mild, and then it gets pretty intense. Okay, so what is a heart attack? Somebody might be asking what a heart attack is. So let's cover that part, and then we can move on with that. Heart attack basically occurs when the flow of the blood to the heart is severely reduced or blocked. Okay, so the blockage is usually due to a buildup of fat, cholesterol, and other substances as well in the heart. I've done a video on cholesterol if you want to take a look at that. Sometimes a plate can rupture and then obviously form a clot that blocks the blood flow. A lack of blood flow can damage or destroy part of the heart muscle. Okay, just to clarify, this is actually an emergency matter. This is an emergency matter. So when that happens, you have to seek help as soon as. It is very important to know the difference between heart attack and a cardiac arrest. These two are slightly different, so it's important to know when it's a heart attack and also when it's a cardiac arrest as well. A heart attack, like I said, arises when there is a problem in the circulation of oxygen to the heart. Okay, while the cardiac arrest is caused by an electrical or mechanical problem in the heart, such as abnormal or irregular heartbeat, and it can cause the heart to stop suddenly. So that's what a cardiac arrest is. Okay, death can occur within just moments after the heart stops beating. Okay, death can occur within moments when the heart stops beating. So it has to be treated as a medical emergency. Both cardiac arrest and heart attack can be treated, but time is of essence. Okay, this is something, when we say emergency, guys, I don't know how you see that, but emergency is emergency. This is something that needs to be treated as soon as possible. There's no thinking twice, there's no hesitating. You have to really treat it. So now let's talk about the signs and the symptoms of these two. So symptoms and signs can vary. Others may have a mild one, and others may have a very heavy symptoms as well. So you can have things like chest pain that feels like pressure. Sometimes they feel kind of like tightness, squeezing and aching on your chest. You can have pain and discomfort as well that spreads to the shoulder. your arms, your back, your neck, and your jaw as well. The pain spreads. Okay, you can get cold sweat as well. You can get fatigue, tired, nausea, heartburn, shortness of breath, dizziness, and you can, have fast or uneven heartbeat. Okay, these are some of the things that you need to look out for when it comes to heart attack and cardiac arrest. Okay, so angina is not a heart attack. Okay, although it can signal a heart attack, so it means chest pain. Now, causes of heart attack, and I want us to take these notes seriously. Because it will save your life. All right, so your heart muscles needs constant supply of oxygen rich blood. Your coronary arteries give your heart this critical blood supply. Okay, so if you have coronary artery disease, these arteries become narrow and the blood can't flow as well as it should. When your blood is blocked to your heart, you have a heart attack. I hope that makes sense. Okay, so the fat, the calcium, the protein, inflammatory cells build up in your arteries to form plaques. Now, risk factors. Okay, so when you're aged 45 and older, and women 55 and older, men, for example, they have a tendency, should I say, of having a heart attack. Okay, tobacco smoking or long-term exposure to secondhand smoke, meaning you breathing it in when somebody is smoking, that can also affect your health. Okay, high blood pressure over time. High blood pressure can damage arteries that lead to the heart. So high blood pressure can occur with other conditions like obesity as well, high cholesterol or diabetes. So you can also have family history as well. Maybe there's somebody in your family who has heart attack. Okay, so sometimes it may run in the family, genetics. Sometimes it may be because you don't do enough exercises, getting your blood flow going. That could be another reason. Also, unhealthy diet, high in sugar, animal fat, and processed food. Salt is another killer. Okay, you've got stress as being one of it, illegal drug use, history of preeclampsia causes your blood pressure during pregnancy to go high. So these are things that are high risk. So when you have things like that, say in your family history, you're smoking, you're drinking, unhealthy diet, no exercise, stress, all these things are bad for you anyway. But I would pay particular attention to these things, just so that it doesn't add to you having a heart attack. Okay, I'm not saying those are the only things. There are other things as well. So just make sure you minimize as much as possible certain things. Have a change of lifestyle as well, and that helps. Any kind of pain you feel in anywhere, do not ignore it. Make sure you pay attention to certain pains that you're feeling, because that can be leading to something else. Okay, so I hope that helps you, and I hope that helps you in helping yourself if that happens to you, or if you know somebody else who has that stroke or attack or things like that to the heart and the chest. I hope that you make an emergency, you make it a critical an emergency to be treated. All right, so if you guys have anything else you want to ask me, please feel free to put it in the description box below, and I'm going to see you next time. Take care. Bye.